Do you know the difference between a quack and a doctor? It's a question that could be critical to your health. A quack is generally someone who falsely claims to possess medical knowledge or skills. They may peddle unproven or dubious treatments, often capitalizing on the desperation or vulnerability of those seeking help. On the other hand, a doctor is a medical professional with recognized qualifications. They have undergone extensive education and training in medical schools, followed by intense internships and residencies. They offer medical care based on scientific evidence, adhering to ethical standards and established medical practices. Doctors are also accountable to regulatory bodies, ensuring that their actions are always in line with recognized standards. In a world where misinformation can be dangerously misleading, it's important to know who you're trusting with your health. Understanding the difference between a quack and a doctor is crucial for your health and well-being. First off, let's discuss qualifications and training. When it comes to acquiring the skills and knowledge necessary to provide medical care, doctors go through a lengthy and rigorous process. This journey begins with a demanding course of study in medical school, where they learn the fundamentals of medicine and human biology. Following this, doctors embark on internships and residencies, gaining hands-on experience in real-world medical settings. This entire process is carefully structured to ensure that by the time they're ready to practice independently, doctors have a comprehensive understanding of the human body, disease processes, and the most effective treatment methods. Now contrast this with quacks. These individuals often lack any formal medical education or qualifications. They may have some knowledge or training in health-related areas, but this is usually far from the in-depth, rigorous education and training that doctors undergo. A doctor's qualifications and training ensure they have the necessary knowledge and skills to provide medical care. Next, let's delve into evidence-based practice and ethical standards. Doctors operate on the principle of evidence-based practice. This means that they base their treatments on scientific evidence gathered from rigorous research studies and clinical trials. They follow established medical guidelines, ensuring that the care they provide is not only effective, but safe. On the other hand, quacks often promote therapies that lack empirical support. They may peddle unproven or pseudoscientific treatments, disregarding the potential risks and harm to their patients. Additionally, doctors adhere to a strict set of ethical standards. These standards, set by medical boards and organizations, govern their professional behavior. They guide doctors in making decisions that respect the rights, safety, and dignity of their patients. Conversely, quacks may engage in fraudulent practices, making false claims to exploit vulnerable individuals. They operate outside the realm of professional ethics, often prioritizing profit over patient well-being. A doctor's commitment to evidence-based practice and ethical standards ensures you receive reliable and ethical medical care. Finally, let's discuss accountability. Doctors, unlike quacks, are held to a high degree of accountability. They answer to medical boards and regulatory bodies, and these organizations ensure that the actions of doctors align with established medical standards. These standards are put in place to protect patients and to ensure that doctors are providing the best possible care. In stark contrast, quacks often operate outside these regulatory frameworks. They are not held to the same level of accountability, and they may avoid any responsibility for the outcomes of their treatments. This lack of oversight can lead to harmful or ineffective treatments being administered, with no recourse for the patient. Accountability is a crucial aspect of medical care. It ensures that your health is in the hands of professionals who are not only qualified, but also responsible for their actions. This is one of the many reasons why it is essential to seek healthcare from qualified professionals. A doctor's accountability to professional bodies ensures they provide care that aligns with established medical standards. So, to summarize, we've spent the last hour delving into the world of medicine, exploring the stark differences between legitimate doctors and those who falsely claim to have medical knowledge or skills. These individuals, known as quacks, are often promoters of unproven or dubious treatments, offering quick fixes and miracle cures instead of evidence-based medical care. But as we've seen, the gap between a quack and a doctor is as wide as it is deep. Let's take a moment to recap the key distinctions we've discussed. First and foremost, we have the issue of qualifications and training. Doctors, as we know, have completed rigorous education and training in medical schools, followed by internships and residencies. This process takes years, even decades of dedication and hard work. It's a journey that is designed to ensure that by the time a doctor begins practicing, they have a comprehensive understanding of the human body and the many conditions that can affect it. On the other hand, quacks may lack this formal medical education and qualifications. They may have some knowledge, perhaps gleaned from unverified sources, but they lack the depth and breadth of understanding that comes from formal, rigorous training. This can lead to misdiagnoses, incorrect treatment recommendations, and ultimately harm to patients. Next, we have the principle of evidence-based practice. Doctors base their treatments on scientific evidence, following established medical guidelines. They stay updated on the latest research, constantly learning and adapting their practice to reflect new findings. This approach ensures that the treatments they offer are the most effective and safest options available. Quacks, however, often promote unproven or pseudoscientific therapies lacking empirical support. They may claim that their treatments are revolutionary, but without the backing of rigorous scientific research, these claims are unsubstantiated. And without evidence, there's no way to know if these treatments are safe or effective. The third key distinction we've discussed is the adherence to ethical standards. Doctors operate under a strict code of ethics, set by medical boards and organizations. This code guides their practice, ensuring that they always act in the best interests of their patients. Quacks, unfortunately, may engage in fraudulent practices, making false claims to exploit vulnerable individuals. They may promise cures for incurable diseases, offer treatments that have not been tested for safety or efficacy, or charge exorbitant fees for services that provide no real benefit. This lack of ethics can lead to serious harm, both physically and financially. Finally, we come to the issue of accountability. Doctors are accountable to medical boards and regulatory bodies. These organizations ensure that doctors' actions align with established standards, and if a doctor fails to meet these standards, they can face serious consequences. Quacks often operate outside these regulatory frameworks. They may not be registered with any medical board or organization, and as such, there's no one to hold them accountable. This lack of oversight can embolden quacks to continue their unethical practices, potentially harming countless individuals in the process. So with all this in mind, the importance of seeking healthcare from qualified professionals and relying on evidence-based medicine cannot be overstated. If you're ever in doubt, verifying a healthcare provider's credentials and consulting reputable sources can help ensure that the care you're receiving is trustworthy and effective. As we close this discussion, we must remember that our health is a precious commodity. It's something that deserves the utmost care and attention, and that care and attention should always be entrusted to those who have the knowledge, the skills, and the ethics to provide the highest standard of medical care. Remember, your health is too important to entrust to a quack. Always seek care from a qualified doctor.